My name is Paula. I am the Far West Regional Medical Director, and I have been with Access for about 3 years. The core team that I work with, we have physician assistants, nurse practitioners, behavioral health, social workers, as well as a care coordinator and a diabetic educator. I feel that we structured it that way because the first person that you may meet may be one of the providers or one of the nurse practitioners, one of the physician assistants. And then from there, if there are services that we feel that they need or could benefit from, that we can actually keep them all here at this clinic and make sure that we're still all patient-centered, but at the same center. So we don't like to have to refer people outside of this small network if at all possible. I think that our team works because of the fact that we all come from different backgrounds and we all have something to bring to the table. We'll go through cases all the time as far as our patient care is concerned, and we all have different perspectives on how we would treat a patient, and so we're open to different ways of how to treat the same person.
In my opinion, the team model that we have here doesn't take away from my autonomy. I think it expands it. I can work freely, autonomously as I need to, but I have the support of Dr. Charity for expert opinions.
I think it's really great working with a multidisciplinary team because I get to bounce different ideas off of people who didn't have the same educational experience as me. So physician's assistants, Dr. Paula is a DO, and then working with Vince, another nurse practitioner, it's really great to bring all of us together and work together as a team.
I feel the patient that would benefit best from this care team model is the patient with the chronic disease that doesn't really want to admit they have a chronic disease. I think every provider can attest to the patient who comes in and you tell them, hey, your blood sugar is high, your cholesterol is high, your blood pressure is out of control. We need to stay on top of this. And then kind of lose them, and maybe they see a coworker or a peer, and here they hear the same thing. We're very on point with what we need to do for preventative care and to treat these active problems. So they come in, they get great treatment. A lot of these patients with diabetes will also find out that they have a problem with depression as well too. They don't care about what the food they eat or the exercise they participate in because they're just too depressed. So then we have awesome social workers here to help with that, to get them more motivated, to really get them on a good thought process for, to receive treatment. And then we have care coordinators who give them a call at home too, follow up with their blood sugars, really make sure the medication we're prescribing the patients adherent to, they're not having any side effects or anything.
I absolutely love interacting not only with the providers, but more importantly with the patients. I've seen the benefit when it comes to their labs. Patients come in and they're like, well, I never really wanted to see you, but now that I have, I'm so glad that I did because you've opened my eyes up to a lot of the things. Most people think it's a negative thing when they send you to an educator, but once they leave here, they leave a lot more relaxed and a lot more informed.
As a physician assistant, I feel that with the multidisciplinary roles that are available in Access, it's been great just because if there's ever any help that we need, we can always reference the teammates that we have. For our patients, when they come in through the front doors, starting with the front staff, with our medical assistants, and then come along to see us afterwards, I feel it's been amazing just because either they come in very happy, very strong right away, otherwise if they don't, when they come and see us anyway, we're still able to turn that frown upside down into a smile.
I've always believed that, about the mind-body connection and how it's all related. And I started to find that it was, so helpful for patients to be able to go see their doctor for their physical needs, and as they're, seeing the doctor and being assessed, they're also getting screened for mental health needs, which sometimes it's related to their mental health. If they're having anxiety and they're having any muscle tension and headaches and palpitations, and then the provider will send them over to me, and they felt really like they were well taken care of. It was so nice to see that wraparound approach.
Before we started this patient care team model, we would have had to follow up on everything ourselves and just hope that the patients followed through with what we'd asked them to. So there's a lot more uncertainty. So now it's just a lot more certain. The patient leaves feeling confident that they have a plan. We feel confident that they've left and they're going to follow through with what we've recommended, and it's just a lot bigger safety net for the patients.
I feel very fortunate to work in an environment like this because I can see that the patients really need our help. They just drown in the healthcare system. If there was nobody to guide them, they would be lost. Patients feel like they're in a world of chaos. Healthcare is so complex. They have appointments left and right that they can't keep track of. They don't know if their provider knows what the specialist said. They don't know if anybody's aware of what they're going through. And I feel that I am that liaison that helps them put all the pieces together.
If there's a provider out there who's hesitant to participate in the team aspect that Access is putting forth, they need to really consider all the benefit it does for the patient. Without the team, you're just an island. You're trying to cover behavioral health, you're trying to cover psychological issues, medication adherence, dietary control. You know that your patient's going to be in good hands and that you can move on to the next patient. And you impact enough patients, and you're impacting a community. And that's essentially what Access's goal is.
Done? It wasn't too bad.
Like that, right? Perfect.
And it's Huerta.
But, well, no sound.
Caesar Huerta.